1st of October, and as you can see outside, it's becoming really quite autumnal. We're heading into autumn now, and this could result in an increase in cases in quite a few countries with the autumn weather. But let's look at where we are now, because I've just lost track over the few days when we've been looking at vaccinations and injection technique. Let's go just for a bit of orientation first of all. So here we have the new confirmed cases. So we see that the United Kingdom is actually highest at the moment. Israel going down quite markedly. United States is definitely going down. Ireland is flat. Canada fairly flat. Australia up slightly, and New Zealand thankfully still fairly flat. So that's sort of the trend in the main countries that we're following in terms of new cases. Hospital patients, which of course is the critical thing. Now the United States is going down. It is still patchy in the United States. Some areas are higher than others, of course. But the overall trend is down. Israel, the trend is down as more people are getting a booster dose of vaccine. And some data coming out on the efficacy of that fairly soon. United Kingdom hospitalisations, I think you'd have to say, are pretty level. Canada and Ireland. So Ireland is that one there. So Ireland going down slightly, Canada going up slightly in terms of patients actually in hospital. This is the share of the population fully vaccinated. Now, a lot of people tend to think Israel is high, and it is in terms of total number of doses given. But in actual fact, the number of people fully vaccinated in Israel is less than the United Kingdom, less than Canada, less than Ireland, at somewhere just over the 60% mark. Then comes the United States with a large number of people unvaccinated still. Australia and New Zealand picking up nicely. And Australia did say they're opening their borders to Australian citizens and residents who are doubly vaccinated. So many Australians who've been stranded abroad will be very pleased and be able to get home. These are the deaths. Now, the deaths probably reached 700,000 today in the United States, actually. There's been an increase in deaths. Still that long, the delay in deaths there from the increase in cases in the United States, because the link between cases and vaccines is not as strong because of the large number of people unvaccinated in the States. United Kingdom deaths still going up slowly. Ireland, Israel, been through a bad patch there. Canada, Australia and New Zealand in terms of deaths. Not much to say really in terms of variants. This is kind of what we've got used to seeing now. The alpha variant, the delta variant, sorry, the alpha variant went a long time ago. That was the UK Kent variant. The delta variant, first identified in India, has basically outcompeted all the other variants. And you could argue that although this has caused a lot of problems, you could argue that in a way this is a good thing, because what's actually happened is, because it's outcompeted the other variants, we haven't had the vaccine resistant variants, which of course is good. And as well as that, it's spread herd immunity or developed herd immunity really quite quickly in quite a few places. So quite possible to argue that that's been not altogether a bad thing. So hard to be conclusive about that, but anyway, they're the figures. It is all Delta variant now. That's just outcompeted everything else, and looks like it might do for some time to come, actually. So that's a rough guide of where we are now. What I want to do now is look at a few different countries. Now, I want to start with some information from Canada. Now, the first thing I want to look at from Canada is some useful graphics they've just put out on the rate of cases in the unvaccinated, which the cumulative cases for Canada are pretty high. In most cases have been in the unvaccinated. Cases not yet protected. Now, these are people that are waiting for the 2 weeks after the second dose of their vaccine, and the cases that have been in those. Partially vaccinated people that have had one vaccine, and then cases fully vaccinated, 3.3%. So we can see that the vaccines are preventing people getting infected in the first place, with quite a big efficacy we can see in Canada. So that's cases. Hospitalisation is even more important, and what we notice here, this is tremendously important. The fully vaccinated are so much likely to get hospitalised than the partially vaccinated, than the case is not yet protected because it's not 2 weeks, and the unvaccinated. So this is the main reason we want to press ahead with vaccinations because of this clear benefit identified in the Canadian data, which is great to see, consistent with a lot of other data, and likewise deaths. Now, a few fully vaccinated people have died. These do tend to be older people. They tend to be people with the same comorbidities that we've known all about throughout the whole pandemic. The obesity, the hypertension, the heart disease, the long-term diseases, the diabetes, the renal disease, things that we've known about, the immunosuppressed patients. So there are still some vaccines are not a guarantee, they're not a panacea, but what a difference between the partially vaccinated, the cases not yet vaccinated, and the unvaccinated. So I thought that was some pretty useful data there from Canada. So we're going to look at something else from Canada now as well, hopefully. And here we have, these are the total cases in Canada. So this is the Canada cases here. So as we see, we've got that levelling off that we noticed there in the overall Canada cases. One case in Nunavut, but other cases, it shows you British Columbia, Alberta, Saskatchewan, highish, Manitoba going down, Ontario. It just gives you the graphics. I mean, governments these days have got so sophisticated in their use of graphics. We've really never been so spoiled for interpretation of data. Now, moving on to the United States, as we said, almost certainly today we've reached the 700,000 mile milestone. That's the John Hopkins death figure there, but media outlets in the States are sadly saying 700,000 people have died in the United States, more than died in the 1919-1918 pandemic. Although the demographic that died in that pandemic was largely younger, and of course the population was much, much smaller. So a smaller percentage of the population have died, but an overall larger number. So sobering by any standards, unfortunately, in the States. Now here we have these are the cases in the States. And as we said, we've got this encouraging reduction here in overall new cases. Still high, probably will go up in autumn. Almost certainly will go up in autumn. Deaths, unfortunately, if we look at daily death trends in the United States, still relatively high, but early signs of a reduction there. So we are starting to see early signs of a reduction in the States, which is good. I'll put the links here on here. You can look at it by state. You can look at all sorts of data here. You're completely spoiled for it. I'm just giving an overview at the moment. Patients hospitalised, as we said, going down in most areas, but if you click on your state there, you might find that in some states the hospitalisations are still, unfortunately, higher than we'd like. Let's just have a quick look at Georgia. Let's have a look at Florida. Florida, for example. Oh, going down quite nicely in Florida. That's good because they were very high. Just Georgia also going down. So most states we see this quite nice reduction now in hospitalisations. This one here is the trends in the number of COVID-19 vaccines in the United States, and we see it's going down in terms of new vaccination numbers. As we know, there's still this large chunk of people in the United States that have not been vaccinated. This is why I think we can say with some degree of confidence that there will be an increase in cases in autumn as people start clustering together indoors. Although there's been so many cases in the United States now, there will be a degree of this community-type herd immunity as the Delta variant has been so prevalent. But there's still those unvaccinated people that are going to cause cases and hospitalisations and, of course, deaths in the States. Basically, the position in the UK and the States, my thinking is it's going to carry on going up. Well, we're sort of level now in the UK, and the United States is going down. But I think things will go up. I think there will be an autumn surge. And then I think things are going to get dramatically better as very large numbers of people develop good levels of immunity into the new year. So I really think by January, February, there's going to be a lot less cases. Many countries in the world still not a problem, but still a massive problem really. Still, there's not going to be a reduction in cases because of the unequal vaccination. So still problems there, but less problems next year. Next year, I think, is looking good for the developed countries, basically, although this is going to grind on for quite a few seasons. So that's all the data from the United States there for you to look at. Now, I wanted to check on the Office for National Statistics. There's some good data from the Office for National Statistics in the UK. This is the first one I wanted to show you here. Now, this one is pretty sobering, really. Percentage of adults with moderate to severe depressive symptoms in all of the UK, all of Great Britain, July 19 to August 2021, so fairly up-to-date data. Now, this is pre-pandemic levels of depression. Now, depression is hideously common. 10% of the population with moderate or severe depression. That is a lot, and a lot of people take antidepressants, but definitely gone up during the pandemic time. June 2020, November 2020, January to March 2021, July to August 2021. So that's what we call a temporal correlation. Of course, it doesn't prove that it's caused by the pandemic, but I think it probably clearly is. So the message I would just repeat here is be aware that depression is quite prevalent at the moment. As we go into autumn, people make less vitamin D. We know that low levels of vitamin D are associated with more high levels of depression. There's this thing called seasonal affective disorder when people aren't exposed to the sunlight generally. It is heading into a more depressed time of year on this high takeoff level. Quite honestly, it is a concern because that's quite a high takeoff level of depressed cases there. So two things. Have a high index of suspicion for people being depressed round about you. Does someone appear to be depressed, or do they appear to be the opposite? Do they appear to be overcompensating? Have they got a smiling depression? So just take time to come alongside those round about you. And if you're feeling this in yourself, if you can feel this low mood, this pessimism, this hopelessness, this sort of wretched feeling inside, don't hide it. Tell people about it. It is treatable. It's treatable with things like cognitive behaviour therapy, and it's also treatable with antidepressant drugs. These do work. So let's just be open about it, is what I would appeal, and then we can treat it like any other illness, which is what it is. It's a biochemical disorder in the brain, but it's an awful one to suffer from. So that's interesting and good points for awareness there. Now, the other things for the Office for National Statistics is the actual deaths involving COVID have been increasing. Now, it doesn't look huge. It's these green lines here. But it's actually been increasing for the last few months now. For the last, for about 14 weeks now, I think it's been increasing slightly. Nothing like what it was, of course, at the peak last year, but still nibbling away there, and still a cause for concern. So, and that could well carry on for a period of time as we go into winter and into the first part of early next year. So that is not yet fully behind us, unfortunately. Now, moving on to the COVID symptom tracker data from the UK. Well, we've got a wavy line, haven't we? So you can make what you want of that. That is kind of just varying numbers of cases. There are still quite a few people, about 5 million people, not vaccinated at all in the UK. And this probably will cause, as we've said, more cases and hospitalisations as we go into autumn, which I'm expecting to be the final wave of the pandemic, but we still have it to come. And then the daily summaries from the UK as well we can look at. So these are proportion of the population over 16 vaccinated. It's going up, but it's going up relatively gradually now. But if we look at cases, as we've seen, a bit of a wiggly line in terms of cases. Not really going anywhere, but probably will go up in autumn. Healthcare, likewise, new admissions down, total number of people in hospital down. Great news. Still working through millions of backlog of cases at the moment. So there's still so much collateral damage, the depression and the backlog in other medical cases from this pandemic. Still working through, but the actual number of patients in hospital going down gradually. This could stay level or even pick up a little bit in autumn, in this final surge we're expecting in autumn. Vaccinations in the UK, as we say, looking good overall, but the numbers have actually levelled off quite a bit now. So if we look at the last month, for example, that's the people, the first dose and the second dose. So it hasn't gone up a lot in the last month, and even the last 3 months, not a great increase. And well, the increase in second vaccinations, but not a great increase in first vaccinations. last 6 months and overall vaccination data from the UK shown there on that graphic. So levelling off at the top of the graph, unfortunately, as vaccine take-up is still, you've still got this intransigent bunch not vaccinated. Deaths in the UK, well, as we've said, I'm afraid still going on, and may well do for the rest of this year. So that's a bit of a summary data overall. Just mention in the UK before we go on, Office for National Statistics data. We did look at a couple of graphics from there, but Office for National, this is their logo now. Everyone's got a logo. Antibody level is now 93.6%. So I'm estimating another 3 or 4% of people might have lost their antibodies. So what we're saying is that, I don't know, about 96% of the people in the UK, somewhere like that, have had exposure to this virus or the vaccine now. So these levels of immunity are building up really quite high, considering we went from 0 in whenever it was, January 2020, up to 93.6% now as of the 1st of October 2021. Now, the week ending the 24th of September, also prevalence in England, 1 in 90 people. Last week it was 1 in 80 people, so that's good, down a little bit. Wales, 1 in 60 to 1 in 60, no real change there in Wales. Northern Ireland, 1 in 60, the week ending the 24th of September. The week before that, 1 in 75, so slight improvement there. Scotland, the highest at the moment, 2.8% of the population infected. In the week leading up to the 24th of September, that's 1 in 45, and it was 1 in 45, essentially the same the week before. So cases being maintained in Scotland in terms of prevalence. That's the wavy line, that's the UK official data. And the last country I want to look at today is just some information from Australia. So let's look at some interesting information from Australia. Here we have it. Now, this is the new cases in Australia. Capital Territories, which is essentially part of New South Wales, really. It's landlocked in New South Wales. So there we see 865 new cases in New South Wales. Northern Territories, none. Queensland, 2. South Australia, 1. Tasmania, 0. Victoria, 364. Western Australia, none. So we still see that the pandemic in Australia is pretty well confined to New South Wales, Capital Territories and Victoria. But we also saw that the vaccination rate is increasing rapidly in Australia, and we're expecting it to get to 80% or above 80%, at least in terms of first doses, pretty soon in the next few months, and hopefully 80% doubly vaccinated by the end of the year is the aim for Australia. Now, other things from Australia. This is a interesting graph. This is the overall cases in Australia. So, of course, we know it's going up now, unfortunately. But look at all this long gap here with virtually nothing. That's the wave. That was largely the Victoria wave that was largely suppressed with an excellent lockdown. But then the Delta variant came along, and this is the Delta variant wave. That was the initial one, which, of course, was underdiagnosed. Before the lockdowns, the dramatic lockdowns in Australia got the cases down before this Victoria outbreak, and this long gap, but now we have the genie's out of the bottle, at least in Victoria and New South Wales. This graph shows the number of COVID-19 cases for males and females by age group since the first case was reported. Now, this doesn't indicate, of course, that the disease is more transmissible in young people. It's representing more the demographic of the population and the demographic of the population that got tested. But that's the total profile of people diagnosed since it was first reported in Australia. Male and female. This graph shows the number of COVID-19 associated deaths in Australia for males and females by age group. And of course, as we know, thankfully, very few deaths in younger age group, but there is a few in the Middle Ages. But mostly in the older people from the Australian data, completely consistent, of course, with what we've seen. These are current hospitalisations in Australia, overall figures, and we see that most hospitalisations, of course, are in New South Wales. 8 for 5 people in hospital, 210 in intensive care, and Victoria 308 and 87 in intensive care, 390 5 altogether. Hopefully Australia can remain sealed off like the compartments of a ship or a submarine until the vaccination rates are adequate to prevent that level of hospitalisations or higher levels of hospitalisations occurring in other places. And I'm optimistic that will happen because the Australians are highly aware of this and are going to lift the restrictions gradually. So I wanted to do that partly for myself, really, because you get kind of out of touch with what's going on. So that was a quick summary of what's going on in various places. So quite a few of us, we're going to see more cases as autumn approaches. That's going to increase herd immunity and this community immunity more. I'm expecting the combination of the ongoing vaccines and the ongoing cases, the ongoing transmission, and the reinfections that people get typically minimal infection after the vaccine, to further reinforce immunity. Booster doses, of course, going on now in the United Kingdom and United States and Israel, which is going to boost immunity further, which means I am optimistic that the last major wave of this pandemic we're going to see in these Western countries is going to be towards the end of this year, and things are going to be better next year and into 2022. But we've still got a long way to go throughout 2022 and onto 2023 in countries with low vaccination rates. But we will see the condition rumbling on for quite a few seasons, with a certain degree of cases, hospitalisations and deaths for the next few years, unfortunately. But I believe at a way lower level. So that's where we are at the moment. Still get the feeling really that we've been quite lucky in this pandemic, that although the death rates are bad, they're nothing like as bad as they were in 1918, 1919, and they're nothing like as bad as they could have been if we had a more pathogenic virus. And the good thing about this is countries around the world are preparing now for another pandemic. This has raised awareness that could prevent an even more fatal pandemic in the future. So I'm just trying to balance some good news and some bad news there, I suppose. But there we go. A few months left, I believe, for significant problems in Western countries, a couple of years left in poorer countries. And that's where we are now. And thank you for watching.